This is the High Dose Vitamin C Cancer Treatment Guide, provided by Personalized Medicine, written by the medical director of Personalized Medicine, Olena Ivanova, narrated by Richard Wilson. 50 years of research and clinical use has collected substantial evidence that proves high doses of vitamin C can safely and effectively kill cancer cells while protecting normal cells from chemo and radiation. This guide compiles and references information that was pulled from over 100 cancer treatment studies exploring how vitamin C kills cancer cells. We untangle the scientific vocabulary used in the reports and make the research information accessible to everyone. In many places, you will find links that take you directly to the source information in the written article. By the end of this video or audiobook, you will understand how high-dose intravenous vitamin C, otherwise known as IVC, can safely improve the ability to beat cancer and protect patients from short and long-term side effects of standard treatments. If you have questions about this information, you're welcome to contact us for clarification. You can find a link to our website in the description of this video or audio file. One quick note, you may see vitamin C referenced as ascorbic acid and acerbate in medical articles linked to in the written article. In this video or audio, we will mostly refer to the nutrient as simply vitamin C, VitC, or IVC, specifically when describing intaking high doses of vitamin C intravenously via an IV. So what is a high dose of vitamin C? While the recommended daily value of vitamin C is 90 milligrams, studies show taking high or mega doses can be used to address certain health issues. According to the National Institute for Health, 2,000 milligrams of vitamin C taken orally is a safe daily upper limit for a healthy adult. However, NIH studies have shown IV doses of up to 100,000 milligrams can be well tolerated. High doses of vitamin C used to treat an illness or disease are commonly referred to as pharmacological acerbate. For most adults, high doses of vitamin C taken intravenously are generally considered safe since it is a water-soluble nutrient. Excess amounts are removed through urination. What is the difference between oral and intravenous intake of vitamin C? Vitamin C intake via IV, otherwise known as IVC, produces peak plasma concentrations far greater than what can be achieved through oral intake of nutrient-dense foods or supplements. When vitamin C is taken orally, our body by default will absorb only a small amount, then excrete the rest. However, when vitamin C is administered via IV, those tight biological controls are bypassed, and higher amounts of vitamin C can safely concentrate in the bloodstream for long periods. So quick heads up, the next section talks about scientific measurements, but we think you can handle it. The NIH studied how much vitamin C enters and stays in the bloodstream via IV versus oral intake. The gap is tremendous. For example, vitamin C at a dose of 50 grams administered orally would only produce mean peak plasma concentrations of approximately 220 micromole per liter, compared with 13,400 micromole per liter when vitamin C is administered intravenously. This means over 60 times more vitamin C was available for use in the bloodstream when taken through an IV. So why are high vitamin C plasma concentrations important? We want high vitamin C peak plasma concentrations because lab studies have shown that vitamin C concentrations of 1,000 micromole per liter and greater kill tumor cells. Clinical studies aimed at cancer patients are showing 20,000 micromole per liter and greater be the peak target blood concentration when using vitamin C as a cancer therapy. The evidence shows it is not possible for oral vitamin C consumption to achieve the necessary plasma concentrations to be used as a cancer treatment. Next, we'll cover early studies of using high-dose vitamin C to assist in cancer treatment. Discussions around using high dose vitamin C for cancer treatment involved some controversy because of early conflicting studies. In the 1970s, clinical trials led by Dr. Ewan Cameron and Dr. Linus Pauling, a two-time Nobel Prize winner, showed encouraging results in the fight against cancer using vitamin C. Their trials were focused on patients that were considered terminally ill with cancer. They found the terminal patients treated with vitamin C lived 20 times longer and enjoyed a much greater quality of life than those that were not treated with high doses of vitamin C. An independent clinical trial in the early 1980s conducted in Japan showed similar results. Dr. Linus Pauling challenged the medical community to conduct further testing of using vitamin C to treat cancer. Charles Mortel of the Mayo Clinic heeded the call and led double-blind randomized trials. His clinical trials failed to show any positive effect of using vitamin C to treat cancer. Since his trials were considered to be conducted more rigorously, people trusted the Mayo Clinic's data over the Cameron Pauling trials. What was missing in the Mayo study? A National Cancer Institute article authored by Dr. Lewis Cantley from Cornell and Dr. Ji Yoon of Johns Hopkins clearly explains the two critical differences between how the Mayo Clinic and Cameron Pauling administered vitamin C in their trials. 1. The Mayo Clinic provided vitamin C treatment for much less time. Most importantly, number 2, the Mayo Clinic only administered vitamin C orally, while Cameron Pauling used oral and intravenous methods. The 2004 NIH study we reviewed earlier shows orally taking vitamin C generates far lower plasma concentrations than intake with IV. Cantley and Yoon calculate the Mayo Clinic study would have produced peak plasma concentrations of 200 micromole per liter, while the Pauling studies would produce peak plasma concentrations of nearly 6,000 micromoles per liter in patients that receive vitamin C via an IV. Let's remember, lab studies have shown plasma concentrations of 1,000 micromole per liter can kill cancer cells, with clinical studies showing 20,000 micromole per liter or greater being an optimal peak target. The Mayo Clinic study helped prove that oral vitamin C intake is not enough, but more modern studies have shown that Cameron and Pauling were absolutely correct. Vitamin C administered via IV can help patients kill their cancer. So here's an important note. The Mayo Clinic has acknowledged the shortcoming of their previous clinical trial. They are now conducting a randomized, double-blind, phase 2 clinical trial to study the benefits of using high-dose IVC in combination with chemotherapy. Results are expected to be published in March 2024. Using high-dose vitamin C as a monotherapy versus combination treatment. It should be noted that vitamin C has been researched to fight cancer as monotherapy, administered by itself, and as a combination complementary therapy that is used in conjunction with other standard care treatments. While you can find positive case studies in preclinical studies that suggest vitamin C has an effect as a monotherapy, we believe not enough evidence exists for anyone to recommend monotherapy as an initial sole cancer treatment. However, we will see evidence that shows monotherapy can be an effective palliative care for those with an illness that is considered terminal. In these cases, monotherapy may deliver much better quality of life and lengthen survival by restricting the growth of the cancer, or in some cases, actually shrinking the tumor. Much more research has been completed for high-dose vitamin C infusions as a complementary cancer therapy that shows it plays a role in killing cancer, helps boost the efficacy of standard cancer treatments, and protects the patient from the toxic effect of the standard therapy. Preclinical studies using high-dose IVC as cancer treatment. Since 1989, 71 preclinical studies, 44 of which occurring between 2016 to 2021, were conducted to determine if high-dose vitamin C improves cancer treatment outcomes when combined with other therapies. The evidence firmly points to yes. In these preclinical studies, a positive effect was observed 92% of the time. Most of these studies involved high doses of vitamin C combined with chemotherapy and/or radiotherapy. Preclinical studies treating cancer with vitamin C in combination with chemotherapy. 20 preclinical studies report high-dose vitamin C improves the cancer-killing capability of chemotherapeutics such as carboplatin, cisplatin, oxaliplatin, irinotecan, chlorambucil, fluorouracil, otherwise known as 5-FU, doxorubicin, epirubicin, paclitaxel, docetaxel, gemcitabine, and temozolomide. The studies observe that vitamin C selectively targets cancer cells, increasing oxidative stress on the tumor, which results in damaging the cancer cell DNA. This has a chemosensitizing effect on cancer cells, making them more susceptible to the chemotherapy. This means vitamin C can improve the outcome of patients with cancer that is resistant to chemotherapy. These studies provide evidence that a chemotherapy is more potent with high-dose IVC than without it. In addition to the improved efficacy, vitamin C regularly showed an ability to reduce the toxicity from chemotherapy. This trait can reduce the side effects of chemo, helping patients feel better during treatment. Preclinical studies using vitamin C in combination with radiotherapy. Similar to its role with chemotherapy, high-dose vitamin C has also been found to act as a radiosensitizer in radiation or chemoradiation preclinical studies. There is ample evidence that vitamin C enhances cell radiation cytotoxicity in addition to offering protection from radiation damage in normal surrounding tissue. There are examples of combination radiochemotherapy with high-dose vitamin C increasing overall survival by 50%. Preclinical studies using vitamin C in combination with targeted therapy. Targeted therapy for cancer treatment focuses on proteins that are involved with how cancer cells grow, divide, and spread. A significant amount of preclinical studies have examined the use of high-dose vitamin C combined with targeted therapies such as kinase inhibitors, mitochondrial inhibitors, poly-ADP ribose polymerase inhibitors, and glycolysis inhibitors. The listed studies show synergistic anti-cancer action and prolonged regression can be achieved with the combination. Again, in situations where certain cancer types were resistant to targeted therapy drugs, vitamin C showed an ability to help overcome the non-responsiveness. Like radio and chemotherapies, emerging anti-cancer compounds targeting telomeres, mitochondrial activity, or glycolysis also have shown in preclinical studies to synergize with high-dose vitamin C. An article in the Journal of Clinical Research reports that enhanced treatment efficacy was confirmed for high-dose vitamin C in combination with several hormonal treatments such as estrogen receptor ER and human epidermal growth factor receptor 2, HER2, inhibitors in breast cancer cells, as well as for PARP inhibition in the treatment of AML, TET2 deficient cells, and JQ1, a bromotamine, an extraterminal inhibitor in the treatment of melanoma. The available data strongly suggests the potential of high-dose vitamin C as a secondary therapy for targeted cancer therapies. How has high-dose vitamin C performed in cancer clinical trials? Many clinical trials have shown that IVC combined with chemo and/or radiation, quote, increased overall survival and progression-free survival compared to the institutional averages, decreased toxicities compared to patients treated without IVC, and was considered safe and well-tolerated, end quote. Overall, the positive results observed in the preclinical trials have also occurred in phase 1 and 2 clinical trials. A quick note, Clinical trials are the best way to determine if a treatment is effective at fighting cancer because they include human patients in a well structured program that is documented in detail. Searching PubMed, the main database for medical research, shows there were 16 completed studies that included medium to high dose IVC as a cancer treatment. Clinical evidence that using vitamin C improves chemo, radiation, and targeted therapy treatments. Clinical results are consistent with preclinical positive results. Chemo and or radiation treatments perform better with high-dose vitamin C than without it. The phase 1 and 2 studies combining high-dose vitamin C infusions with chemo and or radiation therapy report an increase in disease control, objective response rate, that's a decrease in tumor size, and overall survival. These preclinical studies included administration of targeted therapies, chemo and or radiation treatments. Examples include temozolomide, carboplatin, paclitaxel, gemcitabine, G-FLIP, erlotinib, mFOLFOX6, chaser regimen, and radiotherapy. Here are 5 clinical examples of IVC improving effectiveness of chemo radiation for advanced and metastatic cancer patients. Here's example 1. It was a phase 1 clinical trial that included 16 patients with advanced pancreatic cancer. High-dose intravenous vitamin C was administered with fractionated radiotherapy and gemcitabine. The combination was synergistic. Following treatment with IVC, 2 patients' tumors shrank enough to become eligible for surgery to remove the tumor. Including IVC in the cancer therapy delivered an overall median survival rate that doubled historical median rates of the same treatment without IVC. Additionally, the authors state that IVC offers, quote, protection from radiation damage in normal surrounding tissue, making it an optimal agent for potentially improving locally advanced pancreatic adenocarcinoma, end quote. The research proceeded to a phase 2 trial. Example 2. A phase 1 trial included stage 4 pancreatic cancer patients receiving IVC, gemcitabine, and erlotinib. After 8 weeks of treatment, 88% of the patients experienced a decrease in primary tumor size. The researchers noted these are incredible results that are superior to gemcitabine alone or gemcitabine plus erlotinib. The researchers request a phase 2 trial. Example number 3. 14 patients with glioblastoma participated in a phase 1 clinical trial. They were treated with high-dose intravenous vitamin C, temozolomide, and radiation therapy. The authors reported that IVC improved, quote, radiotherapy and TMZ effectiveness in glioblastoma patients, improving both progression-free survival and overall survival, end quote. And also, quote, proved to be safe when combined with radiotherapy and TMZ, end quote. The data shows IVC improves results by, quote, sensitizing cancer cells to radiation and chemotherapy, and protect against radiation in chemotherapy-induced toxicity, end quote. The positive results have led to a phase 2 clinical trial. Example number 4. Ongoing phase 2 clinical trials include stage 3B and 4 non-small cell lung cancer patients receiving IVC, paclitaxel, and carboplatin. The published evidence shows that IVC massively improves the disease control rate to 93%. Historically, paclitaxel and carboplatin without IVC delivered only 40% disease control rate. The authors summarized their findings by stating, we demonstrate that pharmacological acerbate, otherwise known as vitamin C, represents an easily implementable and non-toxic agent that may increase treatment efficacy when combined with standard of care radiochemotherapy and non-small cell lung cancer patients, End quote. The study is expected to conclude December 2024. Example number 5. A phase 1/2a randomized clinical trial compared results of a group of patients with ovarian cancer that were given high-dose vitamin C with carboplatin and paclitaxel versus a group only administered carboplatin and paclitaxel. The results showed that the group that received IVC had longer progression-free survival, overall survival, and experienced substantially decreased toxicities from the chemo. The researchers noted that IVC, quote, has an outstanding safety profile, end quote, is capable of, quote, killing cancer cells without harming normal cells, and proved to enhance chemosensitivity of ovarian cancer and reduce toxicity of chemotherapy, end quote. Ongoing clinical trials studying how vitamin C improves chemo and/or radiation cancer treatment results. The promising evidence recorded in numerous preclinical and clinical studies has encouraged many more clinical trials to be launched. Currently, there are 19 clinical trials underway ranging from phase 1 to 3. Cancer hospitals using high-dose vitamin C for cancer treatment include Mayo Clinic, Johns Hopkins Comprehensive Cancer Center, University of Iowa Holden Comprehensive Cancer Center, Cornell University Weill Medical College, and Kansas Medical Center. Which cancer types is high-dose vitamin C effective against? Studies prove high doses of vitamin C can kill cancer cells and improve the capability of chemo, targeted, radio, and hormonal therapy against the following cancer cell types: lung, breast, colorectal, prostate, pancreatic, ovarian, glioblastoma, leukemia, lymphoma, melanoma, gastric, multiple myeloma, head and neck, oral squamous, sarcoma, and cervical. So in my opinion, here's one of the most interesting sections of this audio video, however you're taking this information in. So how does high doses of vitamin C kill cancer cells? High doses of vitamin C has been widely shown to impose oxidative stress and cause DNA damage to cancer cells. But evidence from recent preclinical and clinical studies show that vitamin C has many more mechanisms of action that make it selectively destructive to cancer cells. In total, researchers have observed 14 ways vitamin C damages cancer cells. This variety of attack angles is believed to be the reason vitamin C is effective against many cancer types. So for this next section, prepare yourself. This is the most technical part of this audio video guide. It really should help the viewer, reader understand how vitamin C actually works to kill cancer cells. For those interested, there's the written article that has many links in the guide, and it goes into far more detail the pharmacology of vitamin C as a cancer treatment. But most folks, this is plenty of detail. So here's the primary action: vitamin C damages cancer cell DNA. So high concentrations of vitamin C acts as a pro-oxidant in cancer cells. This means vitamin C generates a lot of reactive oxygen species, otherwise known as ROS. This is destructive to cancer cells. Additionally, it also prevents the cancer cell from protecting itself from ROS. This imbalance that vitamin C creates is known as oxidative stress. This is the reason IVC improves the capability of chemo and radiation. Those treatments generally seek to cause cell death, apoptosis, via oxidative stress. IVC selectively acts as a pro-oxidant to cancer cells because tumors generally prefer to maintain increased levels of iron in and around their cells. When large amounts of vitamin C come into contact with the iron, it triggers something known as the Fenton reaction. This is a multi step chemical reaction that creates an ongoing cycle that generates hydrogen peroxide and hydroxyl radicals. Both hydrogen peroxide and hydroxyl radicals are destructive to cancer cells. Attacking cancer cells from the outside and inside. High doses of intravenous vitamin C lead to increased steady state levels of hydrogen peroxide. Hydrogen peroxide also enters the cancer cell to generate hydroxyl radical internally. This oxidative stress attack from the inside and outside damages the cancer cell DNA, proteins, and lipids. This damage alone often leads to cancer cell death, but also softens or sensitizes the cancer cell so the chemo and/or radiation therapy can be far more effective. Vitamin C creates a cancer cell energy crisis. Furthermore, the Fenton reaction causes vitamin C to convert into dihydroascorbic acid, DHA. DHA can enter many tumor cells through something called glucose transporter. But DHA is an unwanted guest of the cancer cell, so it sacrifices key substances to process it out. This effort leads to an energy crisis that results in cancer cell damage or death. Is high-dose vitamin C safe for cancer patients? High-dose vitamin C is regarded as having, quote, an outstanding safety profile, end quote. Published clinical studies reported that high-dose intravenous vitamin C is well tolerated by patients and no significant adverse events can be directly attributed to vitamin C. Reducing chemo and radiotherapy side effects with vitamin C infusions. Standard treatments like chemo and radiation commonly have a myriad of long-term side effects associated with their use. Both treatments damage the DNA of normal cells, which can result in issues with fatigue, nausea, brain fog, increased risk of infections, and mouth sores. For survivors, they sometimes struggle with long-term side effects like cognitive problems, nerve damage, heart impairments, fertility issues, and a greater risk of secondary cancers. Reducing these side effects is often a priority for patients. Many studies show that vitamin C helps to reduce the toxic effects of chemotherapy and radiation therapy. NIH-published researchers described IVC's, quote, ability to decrease chemotherapy-induced adverse effects should already make it a very valuable addition to chemotherapeutic regimens, end quote, and that including it with chemoradiation treatments can help, quote, avoid standard 20 to 40% rates of severe toxicities, end quote. What are the contraindications of IVC? Unfortunately, high-dose IVC is not an appropriate treatment for everyone. There is a small population of people that can have adverse reactions. Those with renal insufficiency may develop kidney stones because the body is not capable of expelling the additional vitamin C. Red cell glucose 6-phosphate dehydrogenase deficient patients, that's G6PD, receiving high-dose vitamin C may develop hemolytic anemia. Before starting a high-dose vitamin C treatment, a blood test is used to determine if a patient has either of these conditions. Why hasn't my oncologist recommended to include high-dose IVC in my cancer treatment? It is very likely that your oncologist has not read the studies published over the last 7 years, recent systematic reviews, or meta-analysis that lays out the substantial evidence that high-dose IVC can be a potent anti-cancer agent and reduce the toxic effects of chemo and radiation. A digital fact sheet available at our website can help you and your doctor explore how IVC can be incorporated in the treatment plan. You can find that link in the description. Your doctor should be receptive to the information even though IVC is not yet FDA approved to treat cancer. The National Cancer Institute points out that off label use of drugs is very common in cancer treatment. Doctors can review evidence published in medical journals and can choose to include treatments that have shown to be safe and beneficial. IVC checks both of these boxes. When will high dose vitamin C be an FDA approved cancer treatment? A few hurdles must be cleared for high dose intravenous vitamin C to progress from being labeled as an alternative or complementary cancer treatment to becoming a part of the standard care toolkit. The fact that a pharmaceutical company can't patent vitamin C means there is no financial incentive to get approval quickly. It cost approximately $37.8 million to progress a cancer treatment from phase 1 clinical trials through phase 3. Since large pharmaceutical companies have no financial benefit to invest in FDA approval, we need to rely on government grants and private donations to progress these studies through the required trials. Currently, there are 12 phase 2 clinical trials, and this includes a large trial led by the Mayo Clinic and National Cancer Institute. And there's also one phase 3, so there is hope that it will get across the FDA-approved finish line in approximately 10 years or so. However, this means for those that want to use high-dose vitamin C to treat their cancer now, they will likely have to pay out of pocket for IVC. How to get high-dose vitamin C infusion treatment for cancer. For those who live and work in Maryland, personalized medicine can provide high-dose vitamin C infusion therapy at your home or work. We help those in Montgomery County, Frederick County, Carroll County, Howard County, Washington County, and Baltimore City and County. You can visit us at our clinic in Rockville, Maryland as well. It can be difficult to find a clinic or practitioner that has clinical experience administering the treatment, that has also researched the clinical studies and understands the protocol that is required to safely achieve sustained high acerbate plasma concentrations. High-dose vitamin C treatments require appropriate lab screening and also medical history and biometric analysis to determine dosage, and periodic monitoring of lab samples to ensure the treatment is effective. For these reasons, businesses like IV bars and med spas should be avoided. We suggest discussing the option with your oncologist to see if they can administer the treatment or can recommend a local provider. If they are unable, speak with your primary care practitioner to see if they can recommend options. How much does high-dose IVC cost? Costs is dependent on the dose administered and the amount of IV treatments. Dosing is based on a number of factors, and generally patients should seek to receive a minimum of 2 to 3 treatments per week. Those seeking to aggressively treat their cancer can seek daily treatments. An example cost for an 8-week at-home work treatment can range between $9,000 to $12,000, depending on dosage and the amount of treatments per week. Costs are less for IVC administered in our clinic. Medical financing options are also available for those that need it. Is high-dose IVC used for palliative care? Many studies show that high-dose vitamin C is a safe and effective option for patients seeking palliative care. Vitamin C infusions improve well-being and quality of life. Studies report IVC improves appetite, aids sleep while reducing pain, reduces fatigue, and depression. Many studies referenced in this article observed much higher overall survival time for those receiving high-dose vitamin C. Take the next step to develop a care plan. Research funded by the National Cancer Institute, carried out by the best comprehensive cancer centers in the country, are publishing clear evidence that an additional safe and effective tool is available to beat cancer. Some oncologists may be waiting for the progression to FDA approval to be finalized, but many patients don't have 10 plus years to wait for that to happen. If you're fighting for your life, you should be able to use every safe treatment that is available. The high-dose IVC fact sheet found in our description should be shared with your doctor so you can discuss how IVC can be included in your cancer treatment. Those seeking high dose vitamin C infusion treatment in Maryland can schedule a no cost consultation with personalized medicine. You can find a link within the description to schedule that consultation. We thank you for viewing the video or listening to this recording. Again, if you have any other questions or if you think we can help with anything, don't hesitate to contact us at personalizedmedicinemd.co. Thank you and be well.